Hello, everybody. Chris Hoff here. It's been a while since we've had some coffee at my kitchen table. I'm back, and today we're going to be talking about the mental health epidemic through the lens of Michel Foucault and Bruno Latour. Recently, well-known therapist trainer Scott Miller asked on his Facebook page, at what point do mental health info campaigns become recruitment? Provocative question. He went on to give context to his question by detailing how reports of a mental health crisis are constant, that the assumption is that such problems are located within individuals. Are they, and could, as in many other areas of life, this be marketing rather than informing? Leaving another provocative question out there. So when I saw this, I immediately thought of the work of Michel Foucault, since some folks are trying to do away with critical theory. So I thought it might be helpful to look at these info campaigns with a critical lens. And I think the 20th century French philosopher Michel Foucault provides a unique perspective to explore the issue of the mental health pandemic that has been so prevalent these last several years. So Foucault's work centered on power, knowledge, and the way institutions govern individuals. But how does this philosophy relate to our modern mental health struggles? Madness and Civilization. In Madness and Civilization, Foucault delves into the history of madness. He contends that society's definition of madness changed with its institutions, from viewing the mad as possessing unique insights in the Renaissance to confining them in asylums during the classical age. The mad have always been othered. In today's context, our persistent medicalized understanding of mental health and narratives of a mental health epidemic might be seen as another way society controls and defines what's normal and what's deviant. The birth of the clinic. Foucault's The Birth of the Clinic introduces the idea of the medical gaze. This gaze objectifies classifying patients into categories based on symptoms. Within the confines of a clinic, a person's unique lived experience becomes secondary. Instead, symptoms and signs become primary, transforming a person into a case. Could our rapid diagnoses and categorizations of mental health conditions, what J. D'Arrigo and I have called instant psychology, be a reflection of this gaze? Are we reducing individuals to mere symptoms, forgetting their unique lived experiences? How has the rapid diagnosis and categorizations of mental health conditions given rise simultaneously to the narratives around a mental health epidemic? Other questions to consider might be, how has the DSM, the Diagnostic and Statistical Manual of Mental Disorders, affected our approach to mental health? Is it a tool of understanding or a tool of classification and control? Consider the side effects of medication and potential misdiagnosis. Are individuals sometimes reduced to collateral in a grander scheme of standardized care? Power and knowledge. Foucault famously linked power and knowledge, arguing that those in power define what counts as knowledge. Today's mental health discourse is dominated by specific institutions, professionals, and pharmaceutical companies. How might they be shaping our understanding of mental health? The pharmaceutical industry, institutional psychiatry, and insurance companies play significant roles in mental health narratives. Their influence can shape what is considered legitimate knowledge, and how might the shaping of mental health epidemic narrative benefit these institutions? Are certain narratives, like the biochemical model of depression, emphasized due to power dynamics, potentially overshadow other understandings or treatments? Think about the dominance of the biomedical model. Is this prominence due to genuine efficacy or powerful backing? Examine alternative treatments and therapies like non-evidence-based practice therapies or holistic approaches. Why might they be sidelined? Is it because they challenge dominant paradigms or lack powerful proponents? Discipline and punish. In Discipline and Punish, Foucault explores how societal institutions discipline individuals, making them more docile and productive. Our structured educational systems, competitive workplaces, and even certain therapeutic techniques can be seen as mechanisms of discipline. They shape behavior and mold individuals into normative molds. Could the mental health epidemic narrative be an attempt at making us all more docile and productive in ways that serve institutions? The rise in mental health issues, especially among the young, can be linked to societal pressures. Are our schools, workplaces, and even some therapeutic methods subtly disciplining us, leading us to increased stress and mental health challenges? Think about standardized tests, performance metrics, or even behavioral therapies. Do they sometimes prioritize conformity over individual well-being? Consider the societal structures promoting hustle culture or relentless positivity. Are these disciplinary pressures contributing to rising anxiety and burnout rates? The role of technology. In a digital age, our interactions, including those related to mental health, are mediated by technology. While Foucault didn't address digital technology directly and didn't live in the era of social media, his notions about surveillance are strikingly relevant. Digital platforms can act as modern panopticons where individuals constantly monitor themselves. Are these platforms disciplining us, shaping our desires, and influencing our mental well-being? Does the constant self-surveillance on social media exacerbate our mental health challenges? Think about the curated realities presented on platforms like Instagram. How might this influence mental health, self-esteem, and body image? Consider mental health apps. While they offer support, do they also normalize continuous self-surveillance and evaluation, potentially exacerbating anxieties? A Foucauldian analysis invites us to question, reflect, and better understand the intricate fabric of societal structures and their impact on mental health. While Foucault's theories can sometimes seem bleak, they also empower us with knowledge. Recognizing the systems at play is the first step towards change, towards building a world where mental health is understood, accepted, and genuinely supported. By shedding light on these patterns, we can hope to pave a more compassionate and holistic path forward. In an effort to move beyond just critique, I now want to turn to the work and influence of Bruno Latour. Bruno Latour, a key figure in the science and technology studies, offers a unique perspective that diverges from the Foucauldian analysis. His work emphasizes the relationships between humans, non-humans, and the networks they form. Drawing inspiration from his Compositionist Manifesto, we can frame a new way to approach the mental health pandemic, focusing on solutions that emerge from the complex weave of society. Networked understanding. Things in the world are interconnected in intricate networks, involving both human and non-human actors. Rather than viewing problems in isolation, one should see them as part of a larger system. Possible solutions in this way is taking a systems approach, of course, address mental health from a systems perspective, looking at how different factors, societal, biological, environmental, intersect and influence one another. Collaborative platforms, create online and offline platforms where professionals from various fields can collaborate and share insights. For example, a digital forum where urban planners, psychologists, and tech developers across discuss the influences and intersections of their field on mental health. Matters of concern. Latour's insight was to shift focus from matters of fact to matters of concern, emphasizing the relational nature of entities. Instead of solely focusing on diagnosis or facts of mental disorders, emphasize the lived experience and concern of those affected. Develop therapy and counseling practices that prioritize the unique lived experience of those that seek help. Some possible solutions are narrative medicine, train healthcare providers in narrative medicine, allowing them to listen and to understand the full stories and concerns of their patients. Community voice. Amplify the voices of patients and communities in research and treatment discussions. Patient advocacy groups can play a pivotal role in highlighting real-world concerns over clinical generalizations. Non-human actors. Latour's insight was that non-human entities, from technologies to microbes, play crucial roles in our networks and need to be considered as essential actors. Some possible solutions include acknowledge the role of urban design, technology, and even gut microbiota in mental health. Consider, for instance, how city planning that promotes green spaces might elevate stress, or how certain technologies might be designed to enhance well-being. Emphasize the role of these environments, urban designs, pollutants, green spaces, third spaces in mental health. Policy changes can be influenced by recognizing these non-human actors. For example, ensuring city planning integrates green spaces as they've been shown to reduce stress and increase well-being. Composition over critique. Latour's insight was, instead of just deconstructing or critiquing systems, we should also focus on composing or building alternative solutions. Some of those solutions might be, beyond critiquing pharmaceutical or therapeutic practices, work to compose new models of care, develop community-led initiatives, alternative therapy forms, and grassroots movements focusing on mental health. This includes innovative treatment models. Instead of solely critiquing the dominance of the pharmaceutical approach, invest in researching and developing complementary treatments, be it mindfulness practices, art therapy, or community-based programs. Policy incubation. Set up think tanks or incubation centers where innovative policies or interventions for mental health are brainstormed, tested, and refined before wider implementation. Collective pursuit. Latour believed solutions emerge from collective endeavors where various actors come together, negotiate, and collaboratively build a better future. So some of the solutions might be foster collaboration between stakeholders, patients, caregivers, professionals, policymakers, and the general public, organize community dialogues, participatory research, and collective brainstorming sessions to address these mental health crises. Stakeholder conferences. Organize annual or biannual conferences that bring together a wide range of stakeholders from patients to policymakers, ensuring a comprehensive dialogue on mental health issues and solutions. And of course, collaborative research. Foster research collaborations across countries, disciplines, and sectors. Such endeavors could lead to richer insights, drawing from a diverse pool of experiences and expertise. In essence, applying Bruno Latour's insights in a detailed manner underscores the importance of interconnected thinking, inclusive dialogue, and innovative collective actions in addressing the mental health pandemic. While Foucault alerts us to the power structures and disciplinary mechanisms, Latour prompts us to see the world as interconnected networks and emphasizes the act of composition. By blending these perspectives, we can approach the mental health pandemic with a nuanced understanding and a proactive mindset, focusing on holistic, collective, and innovative solutions. Thank you for joining me today. Remember, understanding is the first step to change. If you enjoyed this analysis, please share, like, subscribe, or whatever for more content that's coming. Thank you, everybody. Peace.